Hey everyone, and welcome to YouthLINE Live. This October 7th, 2014, we've got a fantastic show for you guys. I'm going to be interviewing Mitchell Zexter, who...
Hi, I am a current med school applicant.
Yeah, so today's show is going to be focusing on education and careers in the medical field. Mitchell is 25 years young, born in Ukraine, but raised in the Bay Area, and he's going to be discussing the steps he took all the way from middle school to high school to college, and even applying for medical school, so that you guys at home who are interested in becoming a professional in the medical field can have a better idea of how to enhance your CV, and how to make sure that you take advantage of the many opportunities in the San Francisco area. But before we start, I'm going to have Mitchell go ahead and introduce himself to all you guys at home.
Hi, thank you for that wonderful introduction, Kayla. As I mentioned, I'm a med school applicant. I also do various extracurriculars. I'm the lead scribe at San Francisco General Hospital. I'm a human anatomy post-bac lab instructor. I'm fortunate enough to be one of the teaching assistants at UCSF School of Dentistry for human anatomy. I'm a melanoma research assistant, and I'm taking Spanish for fun. Why not?
But all nerdiness aside, you are a normal human being with hobbies outside of the medical field.
That is true. I do enjoy doing things that are a little less educational in like the traditional sense. I like to dance. I think it's kind of fun.
Mm-hmm.
You can build a really great trust with your partner or whoever.
You danced professionally, is that correct?
No, that's really flattering. But
No, he did.
I was an amateur ballroom dancer. I did Latin ballroom for a few years, about 4 or 5 years, and now I just do it recreationally.
A few years. Yeah, and you also skateboard, is that correct?
I do. I've been skateboarding for about 10 years. I believe skateboarding was very complementary to dancing because it taught me how to gain my center of balance. It taught me persistence, and it taught me how to self-reflect. For instance, if I didn't know how to do a trick or the board wouldn't flip the proper way, I would reevaluate the way my feet stood on the skateboard and would keep trying something new, which I think I've used in my life in all different aspects. If something doesn't work, I reevaluate the problem and then try again.
Different angles.
Totally.
So you skateboard, you were a dancer, you're also a video game connoisseur.
I played video games when I was younger, yeah.
Okay.
I do appreciate them for what they are.
Okay.
I don't get as much opportunity to play them, but I play some Mario Kart here and there.
So the point I want to get across is, although Mitchell has a very intense resume, CV, he is still very much a normal 25-year-old in many aspects with regards to hobbies. Because for me, I know there are people that are like, I love being called a nerd, that's fine. I'm assuming Mitchell
Yeah,
the
there's
same.
nothing wrong with that.
But I feel like there are categories of nerds that focus primarily on educational type things, and that's pretty much it. But then there's a lot of other people who think because of that, like, hey, I don't know if I have it in me. I really want to be a doctor. I really want to be a pharmacist, a dentist, but I don't know if I have it in me.
I understand what you're saying. I think there's just a terrible connotation that goes with any type of word like nerd.
Yeah, I just want the viewers at home to
but
realize
I think if you're
that it's
going to go into
open...
like some sort of like healthcare field, you gotta be a little nerdy, right?
Exactly.
You're gonna be just a little nerdy.
We have a vast demographic of viewers, so people that may be watching maybe 12, maybe 14, maybe 28, maybe 24. The point I want to get across is you don't have to, although Mitchell has a crazy CV, you don't have to only spend all your time doing medical related things. I think what's important is to put yourself out there, but you also need to have a hobby. So you could be you, is what I'm trying to get across. And so we'll go into, we have 20 minutes around left for the show, so we'll go into ways you at home can take advantage of different things. So Mitchell, I'm just going to go ahead and pick your brain. So you knew you wanted to go into the medical profession at what age?
I don't remember.
So a long time ago.
Yeah, I've wanted to go into it for a very long time. I've been fortunate enough to experience different facets of medicine. After I myself have been a patient multiple times. I've broken a fair amount of bones, and I would always be very interested in what like the radiologic aspects were, like what the X-ray said. After my grandfather passed away from melanoma cancer, I was very interested in it, and then I started taking care of my grandmother when she developed breast cancer, and any way that I could be kind of part of the medical community, I'd kind of just dive right in. Back in high school, even, I remember I was a sports med trainer. I worked with junior varsity and varsity wrestlers. And I remember my first patient, right? He twisted his ankle in some sort of wrestling match. And I had to tell him that I have to pull you from the match. As I taped his leg, I was checking his flexion, his extension, just to make sure that his foot was working. And it was fine. It was just clearly very painful, and it could exacerbate the issue if he continued wrestling. So even just having that communication and seeing, there was mild disappointment because, he came to this competition, he wanted to wrestle, but understanding kind of like gave me that spark, and that I do kind of want to pursue this. This is very interesting. I really love communicating with people. I think it's incredibly important to build a connection with whomever you're speaking with. And I feel that the medical career allows me to do that.
And that's a really good point. So for those of you that are interested in, becoming part of the medical field, there are many, different components to medicine. You can go into, become a doctor. You could be a DO, a doctor of osteopathic medicine. You could be a pharmacist. You could be a physical
therapist.
Sorry.
Right.
You could be a nurse. You can be a dentist. There's many different ways that you can be a physician's assistant. And there are many different realms of the medical field. And for those of you that are watching that are interested in one shape or form or another, this show is going to try to give you guys an idea of what you should be working on. It doesn't matter what age you are, what grade you're in. It's never too early to start. You could be in high school, you could be in middle school. So we're just going to go really quickly, starting from middle school, high school, then going into college, and potentially grad school, and tell you things that we think are important for you to take advantage of. So with regards to middle school, I would say it may be cool for you to maybe research different professions that you think you may be interested, and maybe learn a little bit more about it, so that maybe, you may be too young to shadow, but you're never too young to have discussions with experts or to figure out. I think
one of the most important skills that you can develop in those formative years of, tween or
development,
from 12 to 15 and before you're able to volunteer at a hospital is just plain communication. Just being able to communicate with somebody who's may not have the same interests as you. If you are interested in the healthcare profession, there are going to be many times there are going to be people from different cultures, from different backgrounds, from different interests, even different languages, and you're going to have to figure out a way that you can just communicate with them and just understand. And I think that's probably the best thing you can do as someone in that age group.
Communication is very important. You could be the smartest person in the world. You could literally be the best doctor, but you have to realize that being a doctor, being in the medical field, you're not the only part of the solution. You're partnering with that patient and with other people on your team. So if you can't effectively communicate to your patient, to other members of your team, then how effective is what you're doing? So I definitely agree with Mitchell, and I would say that, that's a very important time for you to develop your communication skills and practice. Something that I would suggest when you're in high school is find a mentor. Like if you go to the doctor and maybe you think that you want to become a doctor, do you like your doctor? If you like your doctor, maybe ask him to mentor you. Pick his brain. Ask him where he started. I think it's very important for you to have a good role model. That way they can shape,
That's very true. I think also what's incredibly beneficial at that age group is developing very strong study habits. I know learning can be very difficult for certain people. I remember when I was younger, it was kind of difficult for me to grasp certain concepts. I had to be a kinesthetic learner. I believe we learned that in high school, different types of like visual, auditory, kinesthetic.
And that's stuff that we're going to be talking about in our next show as well. So
great.
Yeah. So there are many. So stay tuned for a show after this one to go into the different study styles. So
you can develop these study skills that are going to carry through into college. For example, I have a 15-year-old sister, so that's an exact age group as these young aspiring individuals. And I tell her all the time, like, why don't you just, if something doesn't work, try figuring out another way of going about it, try to understand it, and I help her with her own things. I'm very proud of her. She gets straight A's, which is something that I did not have until I was in college. So
yeah, and I think
it's really cool to do that when you're younger, so you don't have to worry about it
when you get older.
Yeah.
So if you're that person, maybe in high school, maybe in elementary school, whatever school you're in, and you don't have those great grades yet, do not panic, because
you'll figure it out.
You don't. High school is important because it shapes habits. However, it's more important for you to get better grades once you're in undergrad, I would say.
Well, I mean, what was that saying? You can teach an old dog new tricks.
Mm-hmm.
So
we wouldn't say worry too much about that.
Worry about talking to your friends.
Mm-hmm.
And that's going to make you more woman. It doesn't matter like what field you go into. It'll be very, very helpful.
So I want to talk about taking advantage of opportunities. Did you shadow anywhere in high school? With regards to the medical field?
Yeah.
If you can give us a quick recap.
So, as I mentioned earlier, I was doing sports medicine in high school, and once I got into college, I got my first, not my first job. I was working in high school as a shoe salesman, so it was pretty fun. But I wanted to get more involvement in the medical field, so I volunteered once a week at John Muir Hospital over in Walnut Creek. It was a great experience. It was a level 1 trauma center, and I really kind of got a feel of the way the team aspect of the emergency department works. You see nurses working with doctors, and they can be doing a conscious sedation, for example, and that's when maybe you have to do some sort of procedure and the patient's in and out of consciousness, and so the nurse is putting in the analgesics, which are painkillers or whatnot, while the doctor's ordering and working on a procedure. So it's a great collaborative effort to do anything.
That's very important.
And so I took advantage of that when I was younger, and then I kind of started branching off from
there. So then you started scribing at different hospitals?
I scribed at 2 different hospitals. I did clinical research at San Francisco General, and really the only way that all these happened was I just applied. The one thing that I've learned in undergrad that I thought was the most beneficial thing outside of, knowledge of, academia or whatever is just try. The absolute worst thing that's going to happen is you're going to be in the same position without trying.
You don't lose anything,
You lose absolutely nothing. I studied abroad in Amsterdam because I wanted to live in a city that had a very diverse population. And so I could, again, as I was mentioning, getting used to working with others from different cultures and different backgrounds. When I became a TA human anatomy, I just tried. I was able to get all of my positions just because I sent an email. Really, just because I sent an email.
Literally. So Mitchell TAs at San Francisco State for the postbacks, and now I'm in graduate school. I'm at UCSF. It's literally one of the top dental schools. He emailed my professor and literally just through his resume, he was given the opportunity to at least to give it a shot, and it's been a love relationship with regards to all aspects.
Yeah.
We love it. He loves it. So
I think it's very, very beneficial for me. I'm learning a lot, which I'm incredibly grateful for, and I wouldn't have an opportunity like this if I just didn't try.
Exactly.
Just get out there.
Exactly. So we've got about 7 minutes left for the rest of the show. So I just want to recap what we said. We think that it's very important for you to take advantage of opportunities that you have. You're in school, even though you may be in middle school, you can still take the advantage of, talking to other people, discussing with other people, enhancing your communication skills. You can find a mentor, somebody that can, open your eyes to different aspects of the medical field. You can also get an opportunity to volunteer somewhere.
Yeah. In any university or any high school or community college, whatever, there are going to be opportunities posted on bulletin boards, and you'd be surprised. And these are things that are included for scholarships even, things that can pay for your education. Maybe you need some money for your own personal things. Who knows? All you have to do is apply. There are so many people who don't apply because they think nothing's going to come out of it. And I think the most important thing that you can do, and it's going to be the most beneficial for your overall future, is say yes. Just say yes. Who knows what's going to happen?
Exactly.
Yeah.
Exactly. So with regards to, undergrad, You obviously have to take certain exams if you want to go into certain aspects of the medical field, whether it be the DAT, the MCAT, the GRE. There's a plethora of different exams that you may be required to take. And that's where I think a lot of self-discipline comes into play, because you may not be taking classes that directly correlate with the exam. Despite popular belief, you don't have to major in a medical profession. Or you don't have to major in biology. You can be a history major, an arts major.
Yeah, one of my closest friends, she was a philosophy major, and she got into medical school just fine. Just do your prerequisites. And sometimes it may seem difficult, say you're going into in any healthcare field, you're just like, I just want to be working with people. Why do I have to study this subject, or why do I have to do this? And I think it's very important to keep your eye on the prize. Just what do you really want? And these are just little hurdles that you have to take.
Exactly.
And if it's something really, really important to you, nothing's going to stop you.
Exactly. Another thing that I really wanted to briefly touch on is with regards to just the application process. You are going to be needing letters of recommendation. So we think, it's obviously best to get a letter from somebody that's known you for more than a week, more than a month.
Yeah,
you want them to
definitely
really know who you are, why you want to go into that profession, and what you have to offer. Therefore, whatever age you're at now, wherever you are in this process, it's never too late to meet somebody and let them know what your goals and interests are, pick their brain.
In undergraduate, what's super helpful is going to office hours, but don't go to office hours and just ask really frustrating questions to your professor. But obviously if it's very confusing, you should of course ask. But it's also time to just chat with them and get to know them as a person. As I was saying earlier, the skills that you're going to develop maybe in middle school, high school, whatever, and that's just the communication skills, they're going to take you a lot farther than you think. So I believe you need to do that. And then other opportunities that you may find by emailing, those are also going to build something to your character. If you're applying to these graduate schools, you may want to have some of these letters of recommendation, because you want to say something of substance outside of
Kayla is an amazing girl who has strong aspirations. You can say that about anyone, except that Nancy, Molly, whoever, but saying Kayla is somebody that I've known for X amount of years, X amount of time, and she's highly expressed interest in the dental field for the following reasons. I know that she's been involved in blah, 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 blah. You want to show that you're a leader, that you've reached out to people in the medical field, that this is something that you want to do and why. Because at the end of the day, why do you want to become a medical professional? There's got to be reasons, but it's a very competitive field at the same time. It pays great, you're doing a lot for the community, but the biggest issue is you're responsible for other people in one way or another. And it makes it very challenging for, people who are, looking through admissions for whatever school. It gives them a hard time because they have so many people who want to become involved. And you just need to stand out in one way or another.
You want to do something. And if it's really important to you, it would be very, very apparent.
Exactly. But it's also, it could be very important to you, but you could be a poor communicator. So it's very important that you
develop those communication skills and reach out. You never know who you're going to meet at a coffee shop. You never know who you're going to meet out in your university walking down the hall, or who's really going to take the time. Maybe they were in a similar situation as yourselves.
Exactly.
Sell yourself. Be out there.
Exactly. So we've got about 2 more minutes left. We just wanted to talk about 2 important things. So we are in October. Oh, do we?
We have about 4 minutes. Yeah.
Okay. Just kidding.
A little bit.
So we've got about 4 minutes left. So do you have anything you specifically want our viewers to know about?
Is it Breast Cancer Awareness Month this month?
It is Breast Cancer Awareness Month. So as you can see behind us, we've got magenta-ish pink and we've got purple that way. So the purple stands for
domestic violence, which is also a very serious situation. And I think what's scary is that people who are in DV relationships, sometimes they don't know that they are in those situations. If you feel that you may be in one, just reach out. It's okay.
A lot of it goes unreported.
A lot of it is unreported.
There are places that you can go and talk to people regarding your situation without having to give them too much information.
Right.
One such place is actually downstairs, really 2727 Mariposa. It's called the UCSF Trauma and Recovery Center. So if you are a victim of domestic violence or just want to talk to somebody, they do have people that are mandated reporters, so they may have to report your situation depending on how serious it is, but there are also people that you can speak with that are not mandated reporters, and you can ensure that you're in a safe place to discuss what's going on, your fears. But
you should also remember it's not your fault.
There's no excuse for it.
Your fault.
And a lot of people don't realize that domestic violence isn't something that happens in a heterosexual relationship only. It can work in a homosexual relationship.
It's any way.
In any way.
So parental, it could be relationship, it could be in any way. If any time you feel uncomfortable, you should take care of yourself. You only have one body. You should, enjoy it.
Exactly.
As far as breast cancer awareness,
so 1 in 6 of all U.S. cancers are breast cancer. I think that's a pretty crazy statistic. Also, 1 out of every 8 women end up getting breast cancer.
Yeah, I think there's maybe a higher percentage, but I'm not too familiar. It is really dangerous, and you never know when it's going to happen. For example, as I mentioned earlier, I take care of my grandmother, and she developed breast cancer out of nowhere. She takes care of herself, eats well, never smoked, never drank. It happens. There's a mutation. So the best thing you can do for yourself is get a self-exam, palpate, go see your primary care doctor. If there's any worry, get a mammogram. She did. We ended up being able to facilitate a very expedited surgery. We made sure there's nothing. I come to her house at least once a week and do manual lymph drainage. It may be a side effect. But I'm happy to say, outside of the weird side effect of lymphedema, she's been in remission for the past year, which is incredibly exciting. We actually just went back a week ago and got another mammogram, and she was fine. Take care of yourself. It's really, really, really important. And whatever you want to do, just seek it out and go for it. I think that's about it.
Yeah, it's about how much time do you know how much time we have?
We're done.
Oh, okay. Well, the end.